For years together, the surviving sepsis guidelines have been the basis on which sepsis is treated across the world. These guidelines have really raised the bar to a certain level so that sepsis can be identified and treated uniformly. However, now we know that sepsis is actually a response, a dysregulated response of the body to a pathogen. It brings into the picture a completely different way in which we could actually approach treatment of sepsis. And that is, can we actually individualize it? Can we use artificial intelligence? Can we use some more information to actually tailor make a response, what we would do for this patient? How does that help? Let's just take only two examples in this. What happens is, when you actually have a bacterial infection in the body, the toll-like receptors, they start getting activated. And when they activate, they actually go and identify the PAMPs, the pathogen associated molecular patterns. And this is what ultimately leads to the cytokine storm, which then leads to inflammation in the body, which then leads to what we now know the complete sepsis syndrome with multi-organ failure. If we could actually stop and inhibit the toll-like receptors from getting activated, or we could inhibit the PAMPs from actually getting activated, we could perhaps blunt the response. Nothing in medicine is 100%, so you would still assume that some amount of response would still be there. And what you could then use is some of these filters which have come to actually absorb the cytokines and thereby blunt the response of the sepsis. This is the thought process in which research is going on right now. So look out for this space. There is probably going to be a lot more literature coming out, rather than just looking at giving antibiotics and source control, which obviously is the basis of sepsis management, but you're going to probably look at blunting the immune response a little bit. We've tried this with steroids, we've tried this with IVIG before, but I think there is a whole new thought process of blocking the receptors, blocking the response of the PAMPs and the DAMPs, so that we have a better outcome from sepsis. Thank you.